Today our video is going to talk about cold modalities. And we're going to start off by learning what happens when our body is experiencing these modalities. The first thing on our list is regulate the inflammatory process. So we've already learned from previous chapters and in Sports Medicine 1 that when our body is injured, the first thing that happens is we have that increase in blood flow to that area. I always use ankle sprains as my example, but anywhere you're going to have that increase in blood flow, which is bringing with it the cells that need to be in the body to help the healing process, and a whole lot of new blood, which causes the swelling. When we apply a cold modality, it is going to help limit the increase of blood flow. It is going to limit the amount of extra damage that occurs to the tissues, and that is our second one on the list. When our cells are overcrowded with all this extra blood flow, especially if we were to use heat in this initial injury and have additional extra blood flow, everything gets overcrowded, and then you only have so much oxygenated oxygen in that area that now that there is too many cells that need the oxygen, some of them aren't going to get it, okay? And then anything that doesn't get oxygen is going to die. Other responses that involve using a cold modality is decrease in pain, a decrease in muscle spasm, and the big one that we think about and relate with our injury process is decreased cellular metabolism, okay? And I know we think of metabolism always being like, oh, when I eat food, I have fast metabolism, so it burns it off. Well, metabolism, I like to use the word activity instead, just because I kind of keep those two separate. But how fast your cells are working on the inside. We have fast metabolism and everything is going on full force, running 100 miles an hour, or we have slow metabolism where things are maybe creeping along a little bit. Okay, and so with a cold modality, one of the big things that we're going to see is that decrease in cellular metabolism or decrease in cellular activity. Okay, so I'm going to drag my little box over here for a second. So I have a little question for you. Does an ice bag put cold to the area, or does your warm tissue warm up the ice bag? Or is it both? I don't know. Okay. So I feel like this is something that is important when we're figuring out what modality choice we're using. It's going to remove heat from the tissue, okay? Cold cannot transfer because thermal energy is going to always move from a higher area of higher tissue gradient to a colder area. So in the ice bag skin temperature scenario, the skin temperature is going to be significantly warmer than the ice bag. So the ice bag is actually going to pull the heat from the tissue, okay? And so we kind of have to remember which way our tissue temperatures are warming. Like our moist heat packs were warmer than the skin temperature. So the heat was going from the moist heat pack to the tissue. But we have the opposite effect going with the cold thermal modalities. So a term that we will see now is cryotherapy. Anytime we see cryo, we think about cold, all right? And obviously therapy is dealing with our rehab and that kind of stuff. So together this term means using a cold modality to assist with physical therapy, okay? And there's a lot of goodness that comes with this, okay? And it might be a little more time consuming and you might not always have the tools that you need, but it is something to consider when you're doing your rehab. So with your heat being absorbed from the body with using the cold modality, you start to have all those great cold benefits that we're getting ready to learn, and you're able to incorporate some of your exercises while you are doing your cold treatment, okay? So I do want to kind of remind you, I know we've talked about this in class, but your body does have two different types of reactions to cold or to those thermal modalities. We have a local reaction where, like, we use our ice bag or we use our moist heat pack. Only that area where the modality is placed is going to feel the effects. If I put it on my right shoulder, my left shoulder is not going to get any colder. On the opposite side of that, we have a systemic reaction, where there's enough surface area of our body in the treatment area that we start to have reactions all across our body, okay? And we see this with our bigger modalities like the whirlpool. Okay. So some effects of cold, local effects. Vasoconstriction. Vasoconstriction, those blood vessels are going to get smaller. They're going to contract to limit the amount of blood flow that we see. All right, our circulation decreases. We have the opposite effect going on in thermal. Decreased cellular metabolism, we have already talked about, okay, those cellular activity starts to slow down. The decrease in the cell's need for oxygen. Just like when we learned about effects when our body is going through the hypothermia conditions or like frostbite or frostnip, everything starts slowing down. Your heart rate starts slowing down, your breathing rate starts slowing down, and at a cellular level, the cellular metabolism and the cellular need for oxygen slows down. Everything slows down, okay? We also see the decrease in cellular waste, okay? That goes hand in hand with the metabolism. Decrease in inflammation, that is the decrease in the extra blood flow that is to the area when we have that injury. And then there's a couple other ones that we see, like a decrease in nerve conduction, pain, muscle spasm, and muscle force production, okay? Something that they all have in common is decreasing, okay? Kind of important. So our next category is going to be indications and contraindications. Now, I know we haven't talked about these terms yet, but an indication is when it is okay to do something. Contraindication is when it's not okay to do something. So, for our examples here, indication is going to be referring to when it is okay to use cold. So, it's okay to use cold if we are dealing with an acute inflammatory process. If we are in that first stage of healing. This is different from the thermal modalities. We needed to have those guys in the subacute and chronic stages. Pain, it's always okay to use a cold modality if pain, whether it's an acute pain or whether it's a chronic pain. Ice and other cold modalities are going to help also with muscle spasms, restoring range of motion, and if we have superficial first-degree burns, okay? Just as a good rule of thumb, if these are the complaints, these are the problems, then ice is okay. As far as contraindications go, cardiac or respiratory involvement. If they already have some type of cardiac or breathing condition, it's not as recommended to use a cold modality, especially if it's a systemic one like the whirlpool, okay, and they're sticking in there, your majority of your body is in there. This doesn't mean that they can't use an ice bag or they can't use an ice cup massage. It just is something to be mindful of, especially if it's going to be in a systemic reaction. If they have an uncovered open wound, especially again with the whirlpool because of germs. If they have a circulatory insufficiency, meaning their circulation, their blood flow is decreased, whether that's they normally have decreased circulation, or maybe there's an injury, this injury is causing the decrease in circulation. Also, there's cold allergy and cold reactions that have to do with circulation, like Raynaud's phenomenon and urticaria, are all conditions dealing with how your body responds to cold. So when to use cold, again, this kind of goes hand in hand with our indications. But like we said, we like cold in the acute stages of healing. Okay, we can use it in the subacute, and we can use it in chronic as well. But what makes this different from the thermal modalities is that it is indicated in the acute phase. One thing to keep in mind, though, when you are using it in the acute phase, is about gravity. Okay, if we're dealing with an ankle and that ankle is hanging down, gravity is pushing down, causing it to be harder to get that blood and that swelling to be taken back up by the rest of the body. This is going to lead to increased swelling. Ideally, if you could use the cold modality while having them in a gravity independent position, like with their foot elevated, if it's their foot, okay, is going to be the best form of treatment. We can often see cold used before range of motion exercises, especially if they are limiting their range of motion due to discomfort rather than some other type of limitation. It's more, it hurts when they do this because we know that pain is going to decrease with ice, okay? We always like it when we can incorporate your range of motion exercises or your rehab exercises with the cryotherapy. So our example that we see here is doing the alphabet with our ankle in the whirlpool. That is still having, they are still experiencing that cold modality and have all the benefits of that, but they're also doing range of motion exercises at the same time. We also see a lot, most commonly, after any type of physical activity, okay, and when there's pain, okay. Pain is always going to be an indicator for ice. So just as a rule of thumb, how we're going to decide what modality to choose from, obviously there's things that play a role like what you have available, but when you're deciding between A and B, a couple of things to remember. How deep does that modality reach? Okay, is it considered a more superficial modality, or can those effects of the cold reach lower? Okay, if you are trying to reach a tissue that is deeper in, you pick a superficial modality, are you having a benefit to that treatment? No. So kind of just, you have to think about what you're actually trying to treat. Heat exchange, we talked about this a little bit already, but you're always going to have the heat exchange going from the higher tissue, the higher energy level to the lower. So the warmer area to the colder. So in this case, in the cold modality, the warmth of our skin and our other tissue is going to be pulling towards the ice bag, which in turn is actually melting the ice bag. Okay. Tissue cooling, the depth and the duration that you want the cold treatment to be felt is going to play a role in what modality you choose. Okay. The longer that you have the cold modality on, in theory, there's an increase in the cooling effects, and your temperature is going to get a little bit lower. Now, this is better seen in like a whirlpool because your body is going to continue to melt the ice bag or melt the ice cup, and as it continues to warm, in theory, it's continuing to lose temperature. Okay. We also want to know about how the effects of securing the modality to the body is going to play a role. Using an ACE wrap or the flexi wrap that we see, does that make the ice bag more effective? Okay, in theory, it decreases the tissue temperature better being more tightly secured to the skin as opposed to it just you're sitting your ice bag and holding it on. Okay, so this is actually what our lab is going to be about today. So I will pick up on the next video to finish out our cold aspects and talk about these specific modalities themselves.